Hello everyone, today we'll be talking about compartment syndrome. Compartment syndrome is a painful condition that occurs when pressure within the muscles builds to dangerous levels. So basically an increase in intracompartmental pressure. So this pressure can decrease the blood flow, which prevents nourishment and oxygen from reaching nerve and muscle cells. So one thing you need to know is this condition, it can occur in many areas of the body. However, in this presentation, we are mainly going to focus on compartment syndrome in the lower leg. So compartment syndrome can either be acute, which is basically having severe symptoms for a short period of time, or chronic, which is basically long lasting. So when we talk about the anatomy, compartments are basically grouping of muscles, nerve and blood vessels in your arms and legs, okay? So covering these tissues is a tough membrane which we call fascia. So what's the role of the fascia? It's to keep the tissues in place, okay? So therefore the fascia does not stretch or expand easily. So as you can see in the diagram, especially figure B, you can see the compartment. So there is a deep and superficial posterior compartment, there is a lateral compartment, and there is an anterior compartment. So when pressure in these compartments increases due to whatever reason which you're going to talk about, it will lead to compartment syndrome, okay? So when we talk about compartment syndrome, this develops when swelling or bleeding occurs within a compartment. Because we earlier talked about it that the fascia that surrounds our compartments, it does not stretch. So this can cause increased pressure on the capillaries, nerves and muscles in the compartment. Therefore, blood flow to the muscle and nerve cells is disrupted. So without a steady supply of oxygen and nutrients, nerve and muscle cells can be damaged. So what are the causes? Acute compartment syndrome. So conditions that may bring on acute compartment syndrome include a fracture, a badly bruised muscle, re-established blood flow after blocked circulation, crush injuries, use of anabolic steroid, using constricting bandages. Then causes of chronic compartment syndrome. Basically the pain and swelling of chronic compartment syndrome is caused by exercise. So what are the symptoms of acute compartment syndrome? So the classic sign of acute compartment syndrome is severe pain, especially when the muscle within the compartment is stretched. And the pain is more intense than what would be expected from the injury itself. So basically someone would come and then they'll tell like, I got injured this way. However, when you look at the way they're expressing their pain, it's a lot more exaggerated than what you'd expect. So when you see something like that, do not just think that no, this one is just exaggerating and all that. Try and have compartment syndrome at the back of your mind, okay? Then there may also be tingling or burning sensation, which we call paresthesia in the skin. The muscle may feel tight or full. Then there may be numbness or paralysis, and these are late signs of compartment syndrome. So when you get to the level of numbness or paralysis, just know we're at the late stages, okay, of compartment syndrome. So there is a mnemonic to remember the symptoms of compartment syndrome is the 5 P's. So pain, pallor, which is basically the skin tone will look a bit pale, paresthesia, so they'll complain of numbness, pulselessness, when you try and feel the pulse it will be faint, and paralysis, basically weakness with movements, okay? When we talk about chronic compartment syndrome, which we also call exertional compartment syndrome, this causes pain or cramping during exercise. However, once you stop the exercise, the pain will go away, and it most often occurs in the legs. So the symptoms may include numbness, difficulties in moving the foot, and sometimes with the sense of the foot slapping downward when running, or visible muscle bulging. So what's the treatment of acute compartment syndrome? One thing you need to know is that it's a surgical emergency and there is no effective non-surgical treatment. So the mainstay of treatment of acute compartment syndrome is fasciotomy. Then for chronic or exertional compartment syndrome, the non-surgical treatment is physical therapy, orthotics such as inserts for shoes, and anti-inflammatory medications. However, they may be of limited benefit in relieving symptoms, and they generally do not allow return to full activity. Then surgical treatment, this is only done if conservative measures fail, and surgery may be an option then. So that's all about compartment syndrome. If you have any questions, feel free to ask in the comment section. Like the video and subscribe to my channel. Thank you.